some of the issues that we see with herb-drug interactions, right? And this is kind of like some of the fiction part that I feel like is important to clear up just so you are aware of it. So many herb-drug interactions are theoretical. Okay, so sometimes you'll see like this herb interacts with this drug based on this research or whatever. But if you look at the research, it's actually a theoretical interaction. It's not like, oh, we've got 100 documented cases of this person only taking this drug and this person introducing this herb and there was an adverse interaction and it happened for all 100 people, right? That's very, very rare that we see research like that. Most of the time it's theoretical. This drug relaxes the central nervous system. This herb relaxes the central nervous system. Theoretically, though, since they do the same thing, there will be a bit of an additive or a synergistic interaction there, right? Which makes sense. But I think it's really important to remember that many herb-drug interactions documented are theoretical. And I think it's very important in like monograph listings of herbs that it clearly states that, right? Not that this herb interacts with this drug, but this herb may theoretically interact with this drug due to similar pharmacological mechanisms or things like that. So this is very, very common, the theoretical interactions. One other important issue here is that a lot of herb-drug interactions are based on research done on isolated constituents in plants. Possibly on an isolated constituent in a plant given in much larger doses than you would get if you're just taking the whole plant, right? Whether that's the whole plant in a capsule or as an infusion or decoction or tincture. Sometimes research is done on singular compounds and they're giving like way higher amounts than you would ever get just taking, the normal kinds of extracts that people that use herbs are taking. So there's a number so that's one issue with the isolated chemical research is amount, how much is being given. The other aspect of this is that isolated constituents from plants work differently than the whole plant. Like there's a synergy, there's a biochemical synergy that happens when you take a whole plant where different compounds in the plant are likely affecting the absorption, the metabolism, the excretion, even biochemical transformation happening and interactions happening within the body that just is not taken into account in isolated constituent research. So I think this is a really important thing, is that we're checking like, oh, is this interaction based off of the whole plant or is it based off of an isolated constituent from that plant? And then how much of it is being given, okay? So that's kind of issue number 2 I wanted to note. And issue number 3 is case reports. Case reports of interactions can very easily be skewed. It can be really easy to just say, oh, they took this herb and this interaction happened. But it's a little more complicated than that, right? We got to look at, what other medications is that person taking? Are there other contributing factors that are not being taken into account? Was the herb being documented as being taken actually the herb being taken? Like we need to take that tincture or capsule or supplement and make sure that that actually is the herb that's there. Or was it a single herb? Was it in a formula? Was there a bunch of other supplements in there? And this is important because there's many cases of adulteration that happen in the herbal products industry. One that comes to mind is colt's foot, right? Tussilago farfara. There's been documented case reports of not necessarily herb-drug interaction, but hepatotoxicity from Tussilago or colt's foot due to pyrrolizidine alkaloids. But then they check the product taken or the herb taken, and it turns out that it was adulterated with petacides, butterbur, which is like way higher in pyrrolizidine alkaloids than colt's foot. So these are things that we have to take into account when we're looking at case reports of herb-drug interactions, is that there can be a lot of complexity there that I think needs to be taken into account.